Coming up on My API Health. Enjoy a mindfulness exercise designed to help you stay balanced, reduce stress, and promote an overall sense of well-being. Then, we'll invite a surprise guest to talk about the work that she's done here with the Austin community and some new things that she's been up to these days. So invite your family, sit down, and relax because My API Health starts right now.
Hello, aunties, uncles, friends, and allies. My name is 𝗙ន់🁻🁻, and welcome to the newest season of what used to be called My API Live. We have a new name, a new look, and we're relaunching with a new format. I am proud to announce that our new name is My API Health, where you'll receive accessible, pertinent information. We strive to be culturally informed in our programming by discussing bigger topics that many of us living in America are concerned about. If you're new to this broadcast, the information presented in My API Health is particular to the Asian community, yet still relevant to the greater Austin communities. Language access is integral to the creation of the show, and this unique platform offers it in 3 different languages: Burmese, Mandarin, and Vietnamese, so that we can expand our reach to other people proficient in another language. And you can find each of those languages for this show on our YouTube channel. As you just heard, we have a special surprise guest today, and I'm so excited to bring her on the show. But before we get into anything else, let's start with an easy mindfulness exercise where we bring our focus and awareness towards our breathing. These exercises are great for the whole family. So join me and let's begin. The breath is what connects our minds to our bodies. It is the bridge, and it is the thing that keeps us alive. And that is why when we pay attention to our breathing, we are paying attention and connecting to something deeper that brings us into the present moment. Taking in a few normal breaths, relax your body, whether you're lying down, standing up, or sitting down. Closing the eyes helps to keep out any distractions from what we're about to do, so I invite you to close the eyes if possible. And if you don't want to or can't right now, then just lower your gaze looking down at the tip of your nose. Keep your palms facing up while resting on your legs, or if you're sitting down or standing up, face the palms out in front. Begin to make each breath longer than the last breath, and all through the nose. Notice where the breath is going in and how it's coming out. Do you feel that your belly is filling up with your breath? Or do you feel the breath in your chest? Breathe in, and now breathing into your belly, making the belly rise. And as you breathe out, your belly collapses or flattens out. Breathe in slowly and breathe out slowly, making each breath longer and smoother and deeper than the last breath. Last round, breathe in and breathe out. Open your eyes and move your hands and feet around to bring back the awareness back into your whole body. I hope that was helpful to you and that you're able to carry this calmness wherever you go. Now I'm so excited to introduce our first surprise guest of 2024. This person has been instrumental in the creation of this broadcast when it first appeared as 𝗦𝘗𝗆I Live back in 2020. She started her journey at APH back in 2016 and has pioneered a lot of the work at APH, or Awesome Public Health, that is currently being done in Asian populations and in the Runberg area. I've had the pleasure of working alongside her since 2020 and have also become really good friends throughout the years. So please join me in welcoming Bin Lee.
Thank you so much for having me. Excited to be here.
So glad you could be here with us.
Yeah.
So I wanted to ask you, what is your current title and what do you do there?
Okay. So I am currently the Equity and Inclusion Manager, and I work within the Office of the Director. And I work with a really amazing team of 3 to be able to do racial equity, diversity and inclusion work here at Awesome Public Health. What we do is we implement the racial equity, diversity, inclusion plan for Awesome Public Health. And it really just means that it's a lot of work, but we support 5 different initiatives here at Awesome Public Health, including rolling out the Equity Academy, which is a course for APH staff to be able to talk and normalize conversation about race. We have the Equity Council, which is a group of 25 APH staff who make recommendations for our executive leadership as well as HR on racial equity work. And then we also have the group that you are part of, which is the Equity Review Committee, right? To make sure that the material that we create are appropriate for the community that we serve. And then we also support our LGBTQ equally group, which work on normalizing conversation and issue around the LGBTQ community as well. A process is that this work is not just our unit, but is permeate across the department. And we are really excited to receive so much support and having so many people at APH who are involved in this work alongside us.
That's amazing work. So we're really happy to have you and to be a leader in this field. That's amazing.
Thank you.
How did you actually start with Awesome Public Health?
Oh, that's a good question. So I moved to Austin in 2015, and I really wanted to find community. And I felt like, the best way to do that is actually to work for a city department and being really out there. I also came in at a time when APH was also shifting its culture, and it's very much about bringing our services to community, because we know that there are a lot of health disparities in our community, and a lot of time we expect kind of community come to us, but we wanted to shift our approach where we're very intentional about bringing our services to community. My official title was a neighborhood liaison, and I started at the Health Equity Unit, and it was particularly to start developing relationship in our Asian community. And just because I'm Vietnamese and I speak Vietnamese, it doesn't mean that I'm able to be out there and connect with all the different, we have Vietnamese, we have Korean, we have Burmese, we have Japanese, and so my first kind of challenge was like, how do we start building tool at APH so that we actually able to serve So language access became a really important strategy for us, and to be able to build that space, like when we go out to our community, how do we have not only people who look like our community, but also have interpreter with us, be able to have material that are translated, having relationship with community to really understand the nuances that folks are facing. There are a lot of challenges in the community, and we wanted to make sure that we bring a public health approach to the issue, you know. And I'm excited to have you continue that work at 𝗙liche𝗹𝗹 as well.
Thank you. Well, and as you know, then the pandemic hit.
Yeah.
And through the pandemic came another project, which is kind of this extension from the work that you have been doing, and an extension of a lot of the language access work as well, came, and we all co-created 𝗦𝘗_API Live, which is what we have going on here right now, which now is 𝗦API Health. So I want to know, what did you hope to accomplish when we all co-created this amazing broadcast?
Yeah, it's hard to kind of, right now we're in 2024, and it's just hard to think that the pandemic was only, 3 years prior. But during that time, there were just so many needs as we are trying to bring vaccine to community. And there was also so much misinformation out there. And at APH, we've been building relationship with all community for some time now, and particularly with our API community. And we realized that a lot of folks, even though we're putting out a lot of information from the public health forum, people are not really getting it, or really didn't really understand the information when they read it on a piece of paper. And a lot of time, public health information are written in a way that is very kind of hard to understand, So we've been trying to figure out how to create multiple ways of getting information to community. So what if we just do a show where we lean into our oral history and be able to articulate what is it that we need in word instead of in written form. I mean, not instead of, actually we were doing both, because it's important to have both strategy, right? So that's how we started 𝗦𝘗_API Live, just having it be monthly. No, actually we started weekly.
It was.
Yeah, it started weekly, and then we evolved it, right? Because at the beginning, we just needed information, and it was changing rapidly, and we wanted to make sure that information was getting out to community. What we realized that COVID impacted community, but there's also a lot of need. Like people needed transportation, people needed food, people needed support with eviction, So it's like, where can community go to get those resources? So it kind of bloom and evolve, and we became more like providing a lot of different information and resources to community. And then we also realized that we wanted to make sure that it's accessible in multiple languages. So then one way to build on our language access strategy was to have the program be available in English, in Burmese, and in Vietnamese, as well as in Mandarin. And over time, we kind of evolved, and now we are on another phase of the pandemic, and we really want to use this opportunity, right, to kind of figure out how to continue building our relationship with community, bringing information, broaden it up, and see what else the community need, and be able to respond to that.
It's been an amazing journey, and so you have had quite an impact, not only at Awesome Public Health, but in the API communities. And so we're very, very humbled and proud to have you be a part of that journey.
I'm going to continue doing that work at APH and beyond. So yeah,
excellent. Thank you for joining us, and I'm so glad that 𝗦API Health community is here to listen to what Binh Lee has to say, and to kind of hear about her journey and how we all got here together. Thanks for joining. Now I have some community announcements to make, and the biggest one is about the upcoming annual Community Health Fair 2024, and this is for the Asian populations and beyond. This takes place on July 20th from 10 a.m. until 2 p.m. at the Asian American Resource Center. Austin Public Health is collaborating with our amazing partners, Austin Asian Community Health Initiative, or 𝗙ន់, and the Asian American Resource Center. And we're so proud to bring this to the greater Austin community every year as families are preparing for the new school year. For those of us who need interpreters, we'll have many of the Asian languages covered for everyone's ease and comfort. And all you have to do is to let us know which language you speak, and we'll get you situated. We'll also be offering everything for free, such as free health screenings, vaccines for both adults and children, vision testing, acupuncture, school supplies, and many other free giveaways. So please come out and get what you need while supplies last. Well, this is the end of our show today. So remember, our broadcast is available both on Austin Public Health's Facebook page and the APH YouTube channel. If you enjoyed this programming, please be sure to like, share, and subscribe. And don't forget to hit that bell icon on our YouTube page so that you never miss an episode. We'll see you next time for the monthly premiere of 𝗦𝘁 Health on the 4th Saturday of every month. So thanks for joining us, and be safe, be well, and be kind to one another.